Good morning. I am Dr. Ravi Narayan, an orthopedic specialist who has recently joined Naseem Al Rabeeh Al Rayyan branch. This branch has been recently started with all the medical specialities, and I am in the orthopedic department, and we are trying to cater to all the orthopedic needs of the local population. I welcome you all to this live session on Facebook, and today I am going to talk to you about back pain, low back pain in particular. As we all know, it's a very common condition. In an introduction, let me tell you that back pain is not an illness, it is a symptom. When any person gets low back pain, it means something has gone wrong in his lower back. We have muscles, we have bones, we have tendons, we have nerves, we have the spinal cord, and all these can undergo certain mechanical stress, some loading effects over there. We can have certain diseases which are seen around this region, and invariably because of this we get back pain. Many of the times the problem is a very trivial problem. You have the back pain for a certain duration of time, say a day or two, and it usually gets better. It's only when it gets beyond those 2 or 3 days do you need to get a little bit worried, and sometimes you may have to meet your doctor who will do the needful. I feel that back is a growing problem these days. What do I mean by a growing problem? As we all know, the evolution of man, we all evolved from monkeys. Monkeys were four-legged animals, and as you all know, monkeys never get back pain. And then we evolved from four-legged to a two-legged man. That is what we are today. And our grandfathers or maybe our forefathers who were two-legged, who used to move around and do all their work, they used to walk to their fields, they used to go to fetch water, walk to fetch their food, and they used to do a lot of walking. They never used to get so much of back pain, and if at all they were getting any back pain, it was mainly due to some injury, some fall, but never to the condition that we see today. And today we have moved from a four-legged to a two-legged, and today I would call as if we are a no-legged human being. Why do we mean by low-legged? We hardly walk these days. Many of us are always sitting on the table and chair. We lead a sedentary lifestyle. We spend many hours in our car driving. We drive long distances these days. We travel in flights for long distances, 8 hours, 9 hours flight, and we sit for a long duration of time. And it is all during whole time that your back is getting the stress. The muscles there are getting strained, and this has become the most commonest cause of back pain. So the evolution has its role. We are now today sedentary. We use our laptops, our desktops, spend a lot of time on our mobiles using WhatsApp, Facebook and other things, and I'm sure it is going to have its role. I see a lot of clinical situations in my day-to-day practice which tells me why this problem is also growing. Let me cite you certain examples. A driver comes to me telling me that I have been driving all these days, but today when I drove for about 2.5 hours, I could hardly get down from the car. I had a severe back, and I thought it may disappear in a day or two, but it's been 2 or 3 days now, the pain is not subsiding. Then I come across another situation wherein the person tells me that when I was in bed in the night, when I went to the bed in the night, I was very comfortable. When I got in the morning, I had severe back pain and stiff. Till I could get down and move around, the pain did not disappear. Let us come across to another situation who says that yesterday when I lifted a heavy object from the ground, when I was lifting it, I had no problems, but when I lifted it, I think it was too heavy and I had a catch in the back, but somehow I managed it. I went home, I took rest, and when I got up today morning, I am having severe pain in the back, which is radiating down my buttocks and then going down my leg. This is a typical situation wherein a patient may be having something very severe. When the pain goes down your leg, when you have numbness, tingling, it becomes a little bit more serious problem. I also see many elderly ladies these days. As we all know, our life expectancy is increasing. More and more people are crossing their 80s and 90s. Good health care, and moreover, and because of this, not only that, when we grow older, the bone loses its calcium content and other minerals, and then it has its own toll. And these are the ladies who come and tell me that, doctor, I have been having a pain over my mid back and sometimes the lower back, and I noticed it, and when I asked them how long has it been there, I think more than 2 or 3 months, but I feel it is increasing. And even now, even after I take rest, the pain doesn't seem to be going over. Well, we are dealing here with some different causes of back pain which we see in the elderly, which I contribute them to osteoporosis, osteoporotic fractures, osteomalacia, a different type of disorders. I will tell you about them in the due course of my talk. Then I also see young people who are active in sports. Let us say a child or an adult who is taking part in football. He has a nice game in the previous day, sleeps and gets up in the morning with a severe catch. So these are all the various types of clinical situations we orthopedicians come across in our day-to-day life. People who are working in the construction industries, who stand a lot during the daytime, nurses, drivers who drive for long hours, taxi drivers often get back pain. So it's more common seen in them also. Key points after the introduction: back pain is a symptom and not a disease. Active episodes of back pain, although they are unpleasant and awkward, they usually get better quickly. Back pain affects 80 to 90% of the individuals of the population at some time or the other in their lifetime. Now let me go through the little bit about the anatomy of our spine. Our spine is a engineering marvel. It has got bones which are stacked one above the other, and since I'm talking to you about low back, let me tell you that we have got 5 bones in the lower back, which we call them as the lumbar vertebrae. They are sitting one on top of the other, just like we have slices of bread in a packet of bread. Each bone is connected to the top bone or to the lower bone by joints, which we call them as facet joints. We have ligaments in front of the bones, we have ligaments at the side of the bones, and then we have ligaments at the back of the bones. Ligaments are soft structures. And in between 2 bones, we have another very soft structure which we call as a disc. You must have heard of disc prolapse, disc problems. Well, disc is a soft structure which has got a hard annulus, which is a hard cartilage structure, and a central part which we call as the pulposus, which is a soft jelly-like substances. And many times this causes us problems. And why God has given us this disc and these ligaments? That is the reason why our back is flexible. We are able to bend, we are able to flex. And since the lumbar spine does most of the bending and twisting in our body compared to any other part of the spine, it is this region of the spine which gets most commonly involved in back pain. The vertebral column also holds the very important structure which we call as the spinal cord, which brings down the nerves all the way from our brain down, along with it the nerves, and between 2 vertebrae, wherever there is a gap, and through this gap we find the nerves which come out. Whenever we have any injuries, when a person gets involved in a severe road traffic accident, and if he has sustained an injury to his lower back, or we have a person who has had a fall from height and has sustained injury to his lower back, it is the lumbar spine which usually gets fractured. And many times, if the spinal cord is involved there, the person can get something called as paralysis of both the legs, where the spinal cord is involved. Fortunately, many of the back problems that we see in our clinical practice do not involve the spinal cord. It just involves the nerves or the muscles and the ligaments around the thing. So we are very fortunate in that way. It's only the mid spine or the neck, the back or the upper spine where the spinal cord is involved in many of the diseases. Now I will discuss to you about certain common back problems that we come across. And the first and foremost, I would like to tell you about something called as a non-specific back pain. What do I mean by non-specific back pain? Many times when the patient comes to us with back pain, say for a duration of 1 or 2 days, and we do an examination, we just find that there is some tender spots over the lower back. And the region which is there behind the skin are the muscles, the ligaments, the tendons, the nerves, and we are unable to identify many times as to what is the structure which is involved in this type of back pain. We label this back pain as a common term as a non-specific back pain. Most of the time this back pain subsides within a few days of time and the patient usually recovers fully. Many times they may even have recurrence, but then it is not a problem which we are worried about. Let us discuss about another common back pain problem, which we call it as the disc prolapse or a disc slip, which was called initially. I feel a disc slip is a misnomer because the disc does not slip from its position. The disc is always there, but over a duration of time, as the loads which gets accumulated on the disc, if a person is a manual worker or a person who sits for long duration of time, so this disc always gets its pressure over a period of time, and slowly the disc which has got a good hydration, good water content, loses its water content. It gets degenerated, it gets dehydrated, and it gets damaged. And when such a person has an acute episode, by acute episode I mean when you are traveling in a car and suddenly your car takes a jump over the speed breaker, or you're traveling in a bus and we have a jump, and then there's sudden pressure on this disc which is already damaged previously, it can get hurt and it can leave its place there and can protrude and hurt the nerves which come out. This is called as the disc prolapse, very commonly seen in young individuals, unlikely to be seen in very children, and in elderly persons also we see some other conditions. Disc prolapse is really common in the middle-aged group, especially people who are more active, who are involved in heavy manual work, heavy activities, driving a lot. Okay, then the nerve roots which come out from the bone, they supply the muscles of the limb. They are responsible for our movements, and they also take back the sensations, touch, pain from our limbs back to the brain. So the person who has a disc prolapse complains of pain over the back which goes radiating down the buttocks and back to the leg. Okay, severe pain. He describes it like something like tingling, numbness, something weird, something severe pain, severe catch in his calf muscles, and he has difficulty in getting out of his bed, difficulty in sitting, or difficulty in getting up from a sitting position. So this is what a typical patient with a disc prolapse will come. The doctor examines him, tries to identify what is the lesion based on a clinical examination, does a neurological examination, and we try to find out where is the lesion exactly. Most commonly we get disc prolapse between the 4th and the 5th lumbar vertebrae, and sometimes between the 5th and the S1, that is this first sacral vertebrae, L4, 5, L5, S1. These are the most common disc prolapses that we commonly encounter in our clinical matters. Many times patients come with difficulty or inability to dorsiflex their foot, or sometimes difficulty in extending their toes, which we find out during a clinical examination, and these are the cases that we are worried about. Spondylosis, this is another condition, and all of us, spondylosis is nothing but wear and tear. In the neck we call it as cervical spondylosis, and the lower back we call it as lumbar spondylosis. We drive your car, your tires get worn out. We live long years, we do a lot of activities, definitely our back also undergoes its normal wear and tear, and this is also a common cause of back pain. We call them as lumbar spondylosis. This pain usually is there for a certain duration of time. The pain comes, goes. Usually these are elderly people for obvious reasons. It's wear and tear. We see it in the elderly people. So lumbar spondylosis is more common in the elderly people. Occasionally, we teach them, we provide them some analgesics, we teach them some exercises.